This was an instrument pannier for surgical instruments, but it actually does specify at regimental level. I think nowadays we wouldn't really do so much closing wounds because of the risk of infection, but this may well have been for minor wounds that they'd have dealt with at the time, because one of the things about trauma wounds is that all the dirt and gubbins gets blasted into the wounds, and so therefore there's a huge risk of infection later on, so generally we pack them and send them back. Some of the instruments here haven't changed really much at all in terms of the artery forceps that are used to grip blood vessels and tissue, although again we wouldn't use them at the regimental level to do that. The scalpels, we now use disposable scalpels because of the risk of prion infection, which is to do with mad cow disease. So all of our instruments now are one shot and then thrown away. So a lot of the things here in terms of the spare scalpel blades, which are, in fact actually aren't even sterile here, the scalpel holders, the needles themselves are all reusable here, whereas everything today will be actually thrown away so we don't get a risk of infection. These instruments here, the ones on these side really are artery forceps. So Major Grice would have, if he found a bleeding blood vessel in a wound that was gushing blood, would probably try to isolate that blood vessel and then clamp it off to stop that bleeding. Again, we wouldn't do that necessarily now, but that was probably one of the things that he would have attempted to do. The tendon hammer will be familiar to most docs, and that's just to test the reflexes on the knees or our arms. And I don't know if it's got a specific place in this kit, but it's obviously in here at the moment. There are different types of sutures. We've got these silkworm gut ligatures, and there's also some cat gut ones here, which are very nicely kept in fluid in glass vials, which are a fantastic item. We wouldn't normally use cat gut or anything, but an equivalent would be used, but again, probably not at the regimental level in the field, and would be used to deal with very deep wounds in the hospital environment where it's much more sterile. Today, our instruments, on looking at them, are very similar in terms of forceps, and this was the suture holder that's used to put the needle in to do the stitching, and then a small pair of scissors here. But all of these items are disposable, so they're only used once and then thrown away due to the risk of infection. So that's one very key change. I think one of the key limitations that strikes me about these instruments is the absence of sterility. These would have been probably scrubbed down and washed and probably treated with some form of antiseptic solution in the field, but it wouldn't have got rid of everything, and there would always be a risk of wound infection. However, operating in the field, particularly battlefield wounds, infection is almost a given, which is why we routinely give antibiotics these days as soon as we can in terms of the treatments of the casualty, and I'm sure that was probably also part of the treatment protocols for Major Grice back then.